Thank you everyone for joining our main meeting. Starting this meeting with a heavy heart, I've gotten notifications from several of our colleagues that joined this call about tragedies, and I wanted to share one in particular with you. I got notification from Bob Vogt that unfortunately Harry Hannon has just suffered from a heart attack and is in the hospital and is not responsive. So I think that he wanted me to share with you guys. He used to join these calls and has worked with many people on in this call and in newborn screening in general. So I just wanted to tell everybody and let everybody know that we're thinking about Harry right now. I don't think if it weren't for him, I wouldn't be working in newborn screening. I worked with Harry when he was actually retired, and I was a fellow at the CDC working on SCID screening and SMA, and Harry was very much involved in that after he retired. And he also helped me land my first job outside of my fellowship at RTI International. So Harry was a great mentor for me, and it's just a heavy heart thinking of him during this meeting. So I know Bob Vogt said he might be calling in and giving us an update as well, if anybody else has anything to say or if anybody else has heard about that. I don't know if anybody has any other thoughts they want to share about Harry. So I'm going to go ahead and move on. These calls we have every month, obviously. I know that when you join the call, you're unmuted. So whenever you join, please just mute yourself upon joining, because we do record these conversations. However, if you have something to add to the discussion, this is an open format, and feel free to unmute yourself. We're going to go with our normal standing agenda today. Is there anybody new joining the calls today that would like to introduce themselves?
Hi, I'm joining for the first time. My name is Courtney Bettinger. I'm a pediatrician at the University of Kansas, and I am the new medical director for the Kansas Department of Health and Environment Newborn Blood Spot Screening. I'm glad to be here. Thank you.
Thank you so much for joining the call, and welcome.
Thank you very much. I'm excited to be here.
Do you have anybody else joining the call for the first time today?
Yes, hello. I'm Eleanor Doherty. I'm with Perk and Elmer. I'm a scientist who makes newborn detection assays. And then, yeah, I'm on the just on the phone right now. The Zoom link didn't work for me. It said registration closed whenever I clicked on it, but hello.
Thanks, Eleanor, for joining. We appreciate it. I will go look into the registration issues and make sure that you're able to join the meeting. So if you don't, shoot me an email and I'll make sure I solve it. It should just be on Zoom. It's an open link. It just requires you to ask for other information. So I'll make sure I tackle that issue in the future.
Yeah, this is Lisa Gatland. I was also, the link didn't work for me either, and I know for one of my RTI colleagues, but I got in on the phone.
Oh, okay. Thanks for letting me know, Lisa. I'll look into that as well, okay? Sorry about that, guys.
Thank you.
So we have our normal standing agenda, and I know that one of our colleagues, the colleagues from Georgia, is not able to make it today, as well as Brigham and Women's Hospital, but they have sent their update on the DMD pilot. So we'll go ahead and move on, and we have some updates from APHL as well as NBS. So we can go ahead and get started with the New York team. I know a few of you are on the call, so whoever is Oh, the Zoom and the calendar didn't work for you either, Joe. Okay, I'll make sure, or Michelle, I'll make sure I look into that as well. Are you guys available on the call?
Can you hear me okay? This is Colleen, Jennifer.
Hi, Colleen. Yes, I can hear you just well.
Yeah, actually, it says Michelle on the Zoom call, but it's actually me. We had to share links around here.
Okay, okay, gotcha.
Okay, so I'll start with SMA.
Okay.
Since our March call, we've had one additional infant screen positive for SMA, so we're up to 40 now. And we're still right around 1 in 19 to 20,000. So our incidence rate has remained relatively consistent. For XALD, we've had one additional referral since March, so we're up to 139. And that last referral was a girl with no ABCD1 variants identified, and it's likely a Zellweger case. For Pompeii, we've had 2 referrals since the last call. One was a carrier, and the other one is a possible late onset Pompeii, which was homozygous for a known pathogenic variant associated with late onset disease. MPS 1, we had one additional referral, likely only a carrier, and we have not yet had any confirmed cases of MPS 1.
And you guys have been screening for MPS 1 for how long now?
Since October of 2018.
Oh, okay. So multiple years.
Mm-hmm. Yeah, so we have 6 possible late onset that had 2 variants identified, but they are currently asymptomatic. And GAMT, we've had no additional referrals since the last call. And Joe said there's really no update on the LSD Screen Plus pilot.
Okay.
Since his last comment.
And no update on the New York Screen Plus, right?
Correct.
Is there any questions for Colleen or the New York team? I think it's come up before, Colleen. I'm not sure if you have any information, because with SMA, obviously, with you having the lower incidence rate compared to other states, but also with the MPS 1, since you guys have been screening for a few years now and you haven't, I guess I think the incidence rate for that is projected to be like a 1 in 100,000. So you would assume that you guys would see a positive by now. But do you have information about like the preconception or prenatal testing in your state that might like explain some of why you guys are less frequent?
Yeah, I don't. I mean, it kind of makes sense for SMA because I think SMA is more frequently screened for as a carrier screen. But I don't know that that would be the case with MPS 1. I don't know if Joe or Michelle have any insights onto why we haven't seen a real case.
I don't.
Yeah.
We seem to have a lower incidence of some diseases, and we've wondered that actually, you know, a large population from New York City, if there's more screening going on ahead of time than kind of typical, but we haven't verified or proven that.
Yeah. Mm-hmm.
Yeah, it's kind of difficult. I don't know that NPS 1 is really on, you know, I mean, if people are going for the large carrier screening panels, you know, sequencing panels, it's probably on there, but I don't know. I really don't know the uptake of that, and it's kind of hard to get a handle on. But yeah, it's very, very odd.
Yeah.
Hey, Colin, is Binod from New England newborn screening. So how much is your cutoff for the MPS 1? You have very low cutoff, right? For the MPS 1?
We're, yeah, 6% of the daily
6% of the daily
mean.
Yeah, so you have low cutoff, still you are not seeing the real case of MPS 1.
Just so you know, we've done a lot of, you know, we have had a lot of positives, and we've had, I don't know, it's like a 3-to-1 positive to referral rate, and or I should something like 3-to-1 that end up being ACE, just having polymorphisms or the pseudodeficiency alleles. Mm-hmm. So it's even though our cutoff's kind of low, I mean, it's pretty obvious that we're picking up a lot more pseudodeficiency type cases than we are anything.
Yeah, that's true. I think so. We also see the same kind of situation. Like we also see a lot of pseudodeficiency in MPS 1 cases actually. But I didn't look the data carefully, like if you have real cases. But as you said, we also see a lot of cases of MPS 1 with the pseudodeficiency, definitely.
Yeah, I think we have 62 or so cases with polymorphisms and 30 referred. And out of those the referred population, there's a fair number that look like carriers with pseudodeficiencies. I don't have that number exactly.
Thank you.
And then remind me too, Joe, you might have not before, but did you guys switch to using CLEAR with your MPS and Pompe algorithms?
CLEAR is used with both of those, with all 3 of our LSDs. I don't think CLEAR is a little trickier for IDUA. We don't see a huge reduction in our false positives as a result of CLEAR. So it's, you know, it really is more helpful for us with CRAB-A. It's the most helpful, and next is Pompe. And once we get to MPS 1, we're not getting a huge number of false positives with that tool at the moment.
So I'm sorry, so you are still, even with using the tool, you still are getting some false positives?
Yes, but what I'm saying is it's not eliminating a lot of false positives.
Gotcha. Okay, gotcha. And you guys are not doing the GAGs, on the dry blood spots?
Not at this time, no.
Okay. Any other questions that I know, Dean, you put a lot of comment in the chat. I'm not sure if this was to deal with the New York discussion. Sorry, it's a little long.
No, it's not. It's unrelated.
Okay. I'm going to go ahead and move on to the North Carolina team.
This is Beth. I am standing in for Kate today. I can tell you about CKMM. So okay. I assume she reported to you last month, and since then we just had one additional elevated CKMM. And interestingly, our last 2 have been very high. So the one last month, I'll just give you some follow-up on. The one we had last month was, I think, 7,000, way up there, 7,900, something like that. and that baby did not have any finding on NGS. So we do that 86 gene panel. So no DMD or any other reportable finding. And then this month we've had another that is screen positive that is over 8,000, but I think if I look carefully at it, it looks like it's actually over 10,000. We just don't report that number any higher than 8,000. And diagnostic or confirmatory testing is still pending for that baby. So that brings us to 70 total positive screens and one DMD case in 10,000, which is right about what we expect still.
Oops, oh no, I just deleted, okay. So 70 positive screens, right?
70 positive screens, yep. And again, we've screened a little over 10,000, 10,300 babies.
Okay. Thank you. And then I know that you guys are still up and running for MPS, still in preparation for MPS 2. Any updates on that?
Hi, Lisa. Yeah, Lisa Gatland. I'll give the update for MPS 2. We our approval is in place, and we have all of our instrumentation and reagents. The validation actually is starting today, so either it has started or will start shortly. Our LIMS modules in place, and we have all of our confirmatory. So we should be hopefully ready to start screening this summer.
This summer. I'm sorry, Lisa, you might have cut out just for a little bit, but you said validation is starting shortly. I missed a little bit, and then the summer is the projected screening start.
Yeah, so yeah, we're hoping to start early June. Well, no, I take that back, in June.
Okay. Do we have any questions for the North Carolina team? And I know I ask this every time, but I don't know if anybody's on the state is on the call or if the RTI team feels comfortable giving the update as far as the what's going on in the state of North Carolina screening.
Sounds like nobody's on. I don't feel comfortable talking to the state reporting their activities since I don't know.
Totally understandable. Do you have any questions from the North Carolina team? And we're still, I think last time we asked this too, and there's no projected end date for the DMD pilot, correct?
Not at this point. We are pursuing a no-cost extension to continue screening for the rest of this year.
Okay, that's great. Good to know.
This is Sandra from Minnesota. I was curious. I know you said no findings on NGS for that CKMM that was 7,900, but were you able to get any information, clinical information that might explain the high CK level?
Yeah, that's a great question. We typically do a repeat sample collection for a total CK after 30 days of life, and unfortunately that specimen was not satisfactory. It was insufficient. So we don't have that information. The only other, we do collect labor and delivery information. Baby did have meconium aspiration and required oxygen for about the first 12 days of life. 12 hours of life, let me get that right, and was discharged to home at 4 days of life. So that is the only other, thing that piece of information that we collected. I did want to mention, I have a lot of static. I'm sorry if that's coming from me. I did want to mention the most recent baby with the 8,000, so above 8,000 CKMM level. That baby has HIE diagnosis and had a really significant trauma during labor and has what looks to be moderate HIE.
You can come in. Yes, please.
Thank you.
I don't want to miss.
Thanks for that update. I think that was Beth.
It was, yeah.
Oh, good. Do you have any other questions for the North Carolina team? Okay, I know that the Georgia team had a conflicting call, so they are not on today. And then also the Dr. Prater had was not able to be on today as well, but he did send an update on how their pilot study is going. Just to remind everybody, this is a hospital-based pilot. It's not a state-based pilot, where they have screened over 4,666 infants. They referred 122 to next generation sequencing. And currently they've detected 3 female carriers. None of them have been affected with Duchenne muscular dystrophy. And, but 1 male with the CKM is waiting sequencing. So potentially that had a high CKM result over 7,000. I'm not able to answer any questions about this pilot, but if you have any questions, you can forward them to me and I can send that over to Dr. Prada. And he should be joining next month. Next, I just wanted to see if there was any updates from any of the other states that are on the call. I know previously from Oklahoma about MPS 1. They just started MPS 1, Pompeii, and SMA. We've got some information from Arizona and Minnesota. If they're on the call, they can provide their update, or if anybody else, another state wants to provide that update, please unmute yourself.
This is Sandra from Minnesota. Is the comment from Minnesota, is that about CMV or for one of the other conditions?
I think, sorry, I did not do that, but that is it was about CMV.
Okay.
CMV. I think it was March call, was our last call. I think it just, was it February or March where it was approved?
Yeah, we are still very early in the process. We're in the process of hiring staff to do the testing and figuring out what methods we're going to use. It will be dry blood spot based. This summer we'll be hosting some implementation work group activity to figure out our follow-up processes. If you are interested in any information about the CMV study that we're a part of, I'm happy to provide that as well.
Yeah, that would be great. So is this the study this is like the pilot study was funded by CDC? Is that
Yeah, correct. The University of Minnesota and the CDC that we're partners in for this, for that study. 1 second, I have information.
And that is still, so that's still ongoing?
That is still ongoing. We are ceasing enrollment at the end of September, but we'll continue analyzing data after that, but enrollment will end in September. So right now I have data from February 2016 through the end of December of 2021. We screened 19,919 newborns and 76 were confirmed with congenital CMV. So about 3.8 per 1,000.
You said 19,690?
919, sorry.
919, okay.
Yep, 76 were confirmed.
Okay.
For the dried blood spot aspect, for the analytical sensitivity, one lab was 72.4% and the other was 77.6%.
You said the other lab was 74%?
77.6.
And can you kind of just give us a little background? So I'm assuming that they were, for the labs that were testing that were involved in the pilot, they had the DBS collection, but they also had other samples collected too.
Yeah. So after at the hospital, parents were approached to consent to this study. If they consented, then they collected a saliva swab, and that was sent to the University of Minnesota for testing. That analytical sensitivity was 93.4%. And then after newborn screening was completed, then dried blood spot punches were sent to the University of Minnesota and the CDC.
Newborn screening is Crystal.
For testing for CMV and dried blood spots. So we're able to compare between the dried blood spots and the saliva sample. Any confirmed or any abnormal screening result then received urine CMV PCR testing clinically.
Thank you for that information. Sandra, this is very informative. I think this is the first time we kind of got a little bit more about this on this call. So
yeah,
thank you so much.
You're welcome. Happy to answer any questions. We are submitting an abstract to APHL, so perhaps more information will be shared there at the symposium.
Yeah, I think a lot of us are looking forward to that.
Great, thanks.
For Sandra?
I'm sorry?
I was just asking if there was anybody had any questions for you.
Oh,
okay.
This is
Hi,
Lisa
it's Cindy
Gatland.
Powell.
Yeah.
I'm sorry. Go ahead, Lisa.
Go ahead, Cindy. You go.
Cindy Powell from UNC. I was just wondering, do you know how they're following the positive cases of CMV from your study?
I know that we're getting urine CMV PCR to confirm it. Head ultrasounds, diagnostic audiology evaluations, ophthalmology evaluation. I couldn't tell you the timelines on those. And then I believe liver function tests as well.
Okay. And they're not treating with any of the acyclovir?
Those who meet certain criteria are being offered that option. I don't, off the top of my head, have the number of families who have been offered and who've accepted.
Okay, thank you.
You're welcome.
Lisa, did you have
Lisa
a question?
Yeah, I was curious as to whether you made reference to that you were going to have that meeting to determine what follow-up is going to be, but I'm interested to hear what the likely statewide follow-up is going to look like. Will the hearing program do that follow-up?
It'll be a joint effort. Since the screening will be done by the laboratory, the initial confirmation follow-up will be done by my team with the blood spot follow-up. And then our EDDI program will be involved in ensuring those additional evaluations I mentioned are completed, as well as our long-term follow-up unit in connecting the family to resources and monitoring them for any hearing loss that might show up later in childhood.
And then the New York team asked a good question in the chat, answered about connecting the CMV dry blood spot test results to the hearing screening. And I'm not sure, you said you do, and I'm not sure if you have any results you can share with us about the correlation between the screen positive from the hearing screening versus with the blood spot screening.
You know, I don't have that readily available. I do believe that more clinical information about the children will be shared through that APHL submission we're doing.
Yeah.
Sorry.
Yeah, no, that's good. This is really good information. I mean, I think
I can say that most of them did pass their hearing screening.
Okay, that's interesting.
Yeah, the large majority did pass their hearing screening. I know that we have had at least one, if not several, who initially passed their hearing screening and then later manifested their hearing loss.
I'm sure you're drumming up a lot of interest for the submission, so you should have a well-attended session. Whoever's presenting. So, is there any other? I mean, if you have burning questions for Sandra, please unmute yourself and ask. But I was going to also open it up to see if any other states wanted to report out information. Well, thank you again, Sandra, for your for sharing.
No problem. I'm putting my email address in the chat in case others have questions.
Great. I'm going to copy that down for my own self. And then, so we'll move on to APHL. If anybody's from APHL is on the line and want to make their announcement.
Yes, this is Kashia. So we are accepting abstracts for the Newborn Screening Symposium, which will take place from October the 16th to the 20th in Tacoma, Washington. So if you are submitting an abstract, please note that the deadline is Friday, May 13th, and that's no later than midnight Pacific time. And if you are selected to present, please note that you have to present in person at the meeting because we will have a in-person and also a hybrid meeting this year. So if you are selected to present, please note that you have to present in person. So that's it.
Thanks, Kashia. I was just going to ask you if the plans are still to be in person. So it sounds like in person and hybrid will be options for everyone.
Yeah.
That seems like
and registration. Oh, go ahead. Sorry.
No. I was you go ahead. Go ahead, Kashia.
No, I was just gonna say registration is gonna open in July.
Great. It seems like the hybrid meeting is kind of the common theme for this year for 2022 is hybrid.
Yeah.
And then finally, we have a few announcements from the NBS TR team. I asked Key to unmute herself and make the announcements.
Hi, everyone. I'm Dr. Key Chan. I'm the Scientific Strategy Manager at NBS Trends. I see many familiar and also new faces here and familiar names if your camera's not on, and new names. I like for everyone to have an opportunity to learn more about stories that are stories about people that are impacted by newborn screening and also impacting newborn screening research. There are stories told by parents, advocacy group, researchers, and clinicians. So our latest episode is with Barb Barber, who is currently the director of Skid Angels for Life Foundation. Her involvement with non-profit sector began after her son, Ray, born in 1994, was diagnosed at the age of 10 and a half months old with X-linked severe combined immunodeficiency. She shared her story of work in advocacy work and also many of the big milestones in newborn screening for severe combined immunodeficiency, known as SCID. So I encourage everyone to subscribe to the podcast and share an episode with your friends and colleagues. Next slide. We have a newsletter where we feature events and research impact made by you who are MBS Trends members. And if you're not a member yet, please register an account on our MBS Trends website. Once you're registered, you'll get a highlighted, you'll get the highlights of events and impact made by our community. Our newsletter also highlights the MBRS and data tools and resources. So please register for an account to receive the newsletter. And also, I invite you to connect with us so that we can promote your event. So you have an event, a campaign for an awareness month or a meeting, please email us and we will feature it in our newsletter. Next slide.
Sorry if there's a key.
Oh, no. Okay, yeah, that's right. We're also excited to share our newest MBRS resource, which is the education kit. This education kit that we recently launched is to provide resources for our community to share about newborn screening research. April was Primary Immunodeficiency Awareness Month. So we strategically created a white paper and infographic that highlights SCID newborn screening milestones. You can download this white paper. It's just 2 pages. You can double-sided if you print it out, that you can easily share with your colleagues, print it out. And also an infographic that you see here that highlights the major milestone that was made in newborn screening for SCID. And this is made as an infographic so you can easily post in your social media channels. And also you can print it out if you want as little postcards to send to people. So that's the link where you can get that. And we'll be creating additional education kits as it relates to newborn screening for conditions. So if you have a condition that you would like us to feature, create an education kit, please feel free to reach out to me. Next slide. This is just to highlight the conference call schedule that Dr. Jennifer Taylor hosts here. It's as a reminder especially for the new people who just recently registered for this monthly call. It's the first Thursday of each month at 2 p.m. Eastern time. The next call is scheduled for June 2nd, 2022 at 2 p.m. Eastern time. Feel free to contact Dr. Jennifer Taylor and Dr. Amy Brown here if you have any questions and feedback, and their email is listed on this slide. This call will be posted on our MBRS YouTube channel. So please subscribe to the channel so you can also get video updates when we post something to our YouTube channel. So you see here, this is our YouTube channel link, and feel free to subscribe and also share with your colleagues. Next slide. We're also very excited that we're hosting the MBRS network meeting. This is going to be a virtual event. Please save the date. It's going to be scheduled July 19th to the 20th from 12 p.m. to 4 p.m. Eastern time. During this network meeting, we feature researchers who are working in newborn screening research, specifically working with MBRS data tools and resources. So we like to highlight our members in this community. So please save this date in your calendar. And if you have a chance, if you're curious what this network meeting is about, you can also watch the replay from last year's network meeting, which is on our YouTube channel. So also, if you register as a member, or if you're already a member of NBS Trends, you'll be on our mailing list and you'll get the latest information about upcoming network meeting. We'll have the list of speakers and the themes and topics that will be released in a couple weeks from now. Next slide. In between our monthly pilot calls, please follow us on social media so you can learn about our updates. For example, if you have an event that you would like us to promote in our social media channels, please send those social media posts to us. Or if you have an idea, we can work with our marketing team to help create social media campaigns for your event. So for example, in June next month, it's CMV Awareness Month. So we're going to air a podcast interview with Dr. Megan Pesch, who is the president-elect of the National CMV Foundation, and who's also a faculty and researcher on CMV research at the University of Michigan at Ann Arbor. And so we're going to be featuring CMV research, CMV, how it's also some of the new development on how, the interest in perhaps adding it to newborn screening, and also featuring her interview. So that's an example where we strategically work with our stakeholders to help promote your work. So feel free to connect with me. And that's my last slide.
Yeah, thank you, everyone. We are done a little bit early. I know Dean, you wrote a message in the chat reminding everyone that the ACH-DNC meeting is also happening next week. And I believe he provided the registration link for that. And then if you want to unmute yourself and talk about the comments you're soliciting to, I believe they're trying to not see who reviewing other organizations that maybe they want as participants in the committee. If you want to comment on that, Dean, feel free to unmute yourself.
Sure. Thank you, Jennifer. Dean Sur, MLD Foundation. Yes, the ACH-DNC is meeting next week, and of course, everybody's invited to attend that. But if you register by tomorrow at noon Eastern, you can submit written comments, and we're asking that you write a word or two about supporting the Every Life Foundation becoming a organizational representative. That's a non-voting organization, but the Every Life Foundation just has great perspective and engagement from public health through biopharma and certainly back through advocacy and families. And we just believe that they would bring a good, broad, well-informed, let's make progress, let's improve newborn screening type voice to the committee. So information's all there. You can just search ACH-DNC registration. Just know the deadline is tomorrow at noon. For written comments, I think it's probably Wednesday sometime for just attending. Thanks.
Thanks so much for your comment. And thank you everyone for attending today. And we will see you next month on the 2nd. So thanks again. And you guys have a good rest of your day.